and those who benefit from the money services that we offer. Please guide our minds, keep our hearts and our minds open so that we may have intelligent discussion to arrive at a good decision no matter what we decide. Please guide us on our way home, keep us in good health, and may we always do everything to please you. Amen.
Amen.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. We have the roll call vote, or the roll, please. Steve is here for the committee.
Freedom of Information Act. In compliance with the Freedom of Information Act, notice of this meeting and its agenda was brought into all news media and persons requesting notification. Commissioner Brown Crouch, Commissioner Platt,
Here.
Commissioner Poston, Commissioner Clifford,
Here.
Commissioner Engelmann.
Okay, this meeting is being called in light of the information that received from Mr. Hancock. Did you get a copy of the packet that he provided the meeting that, okay, well, you can copy mine and we can get you one to, he went in good explanation of where we are, where we're headed, and what are the possible ways of adjusting it. Yes.
I'll let him look on.
Okay. And it was a lot of information, so that was good that he provided that to us. Now, the long and short of it is, there are three, and this is the information, we're not here to make a decision tonight. This is where all the work needs to take place. I think a lot of times, our meetings last because the work that needs to be done in committee ends up being taking place at the actual big meetings. So a lot of this work can be handled within our committees. Yes, it may cause more meetings, but I would rather us do the research and come to the full commission with recommendations based off of that information and resources that we have provided, okay? So, of the information, which I said was a lot, and it tells you how we get here. There are tables prepared by actuaries about how our optional employee retirement health benefits come into play with what is also provided by PEBA, which is what the state retirement program is. We have an optional one where we're actually putting stuff in there that other places just don't do. So of the three means to finely tune what we have going on, we either have to consider changing some of the benefits offered to the participants in the district plan, change the criteria for eligibility to participate in the plan, and to determine what contributions to make to the SC orbit for the plan benefit usage. So that's where we're at. He brought up that currently it's 10 years that somebody is vested to have the benefits as we currently have them in the employee manual, and there's some discussion about whether to adjust that figure, not to impair who's been promised what, because there's such a thing as you can grandfather in benefits, because that's not our goal, is to say, hey, you're gonna get this, now you're not. But I think when you see the economics of that everybody on this island is gonna be paying for this too, that has to be given some weight and credibility. So, there are some plans that we can discuss. Lisa, do you have anything with you?
I obviously left one of the prints in the office. I need to go get it. But I thought the first thing would be to see the actual policy. And that's why I left my office.
Is this something we can project up, or you think it's just something that we can hand up to the committee members?
I can put it on a blog talk real quick.
Or sit on the phone and look forward.
Pardon?
Just stick it on the common, I can pull it from there.
It's on the common drive, but it's in the H, so you can't.
Okay, you have to move it.
It's always better to have something to look at when you're talking figures and
Right.
dates. So we'll get our moment to get that together.
Madam Chairman, while we're kind of waiting, I would like for Mr. Platt to please look at page 12, the bottom last paragraph. I think that's very telling, it's kind of a synopsis. The district contributes, $100,000 to fund the plan in fiscal year 2019. This gets on, it would take the district 88 fiscal years to fully fund the plan.
As it's currently written.
As we're going now.
Yeah, that's over in the calculation.
I don't think any of us are gonna be here.
Yep, and also he called attention to page 16 about how can you fund future obligations. In some of these cases, it may be necessary to apply changes only to future retirees or even to new employees moving forward. That goes back to the protection I was referencing with the grandfather clause. And when considering any of these, we do need legal counsel. That's why we're just kind of putting the information we got out here, but we have to make sure that we're in absolute compliance with everything that is legal and with, within the parameters of the actuary tables as well. And like I said, this is optional, so it's nice that we're able to provide this as an added benefit to our employees. We're not, we're not wiping it off the table, but we have to fine tune it somewhere, because 88 years is a really long time. And if he said that there was, 1% fluctuation in either direction, it went up to, if a financial discount rate were to decrease by 1%, this would result in a $1.85 million increase in plan liability for the district. And if it were to increase by 1%, that would result in a $2.3 million increase in plan liability for the district as well. That's going back to page 7, that's down on page 9. And he went in these materials, and I'm kind of doing this as a benefit of catch-up. It's a lot. I mean, we went over it for about 2 hours. I'm kind of trying to give it to you in a nutshell, and then you can reread it later and then meet again, and certainly consulting with counsel about the possible options that may be presented tonight and some other nights, but you gotta get a grip on it first.
Madam Chair, we did put 368,000 in there this fiscal year. I mean, it's not millions, but it's almost 4 times.
Right,
So
wait.
it's current, which I already know the cost. I have my own.
Good clip of one.
I got one, I kicked over mine.
Thank you, ma'am.
You got one more? You got one more?
This is the current policy, as it's been evaluated and estimated for the OPEB liability through Kavanaugh McDonald, which is our actuary. And basically, anyone hired before May 2nd of 2008 with 10 or more years of service, you go down to the green part. That's good. Anyone before 2008 with 10 or more years is fully funded for the employer portion. So they still have to pay the employee portion, but the district pays the employer portion. Also, retired with 10 years but less than 15, you can see there's a zero cost for anyone hired after '08, May of '08. And then with 15 or less years, and then a person with 15 to 24 years of service hired after May 2nd of 2008 has a 50% employer portion paid. And retirees have hired after May 2nd, 2008, which is this next page on this, has a 100% employer portion. So as of right now, the majority, we have about 31 people that fall into this category. We have about 8 people that fall into the one prior to 2008. So that's where the liability comes in. And then right now, we also have the dependent. If you'll go back up to where the headings are on that green part. The dependent coverage is something that is, costs the district a good bit of money paying for the spouse or children that they may have insured as well.
And if there's some kind of impact too, that if they're with the district, state employees, then go to another, let's say they leave for some time and go work for another state-run organization, then come back, so then how we have that play? PIBA dictates whether or not someone is eligible for retiree health insurance, and based on the years of service is how they decide who gets charged for it. So if we had an employee that worked with us for 10 years, and then they worked for the city of Charleston for 15, then the city of Charleston would most probably pick that up. I mean, unless they didn't work as many hours or something, I don't know, but PIBA calculates So
all
they're the
that.
ones that make that determination, so there's nothing that this body could do to aid in that in any arena, because that's all up to them.
As long as it was the last 5 years consecutively worked, basically PIBA decides that. I'm not sure exactly how they decide that, but the expert will be here tomorrow. I'll ask him to make sure that, if there's any way that we can control that.
Okay.
We'll go over each one of these sections, how many people you estimate are on each of these, like that first block. Retirees with 10 years of service but less than 15, how many people do you think we got on that?
We have 24 or 25 retirees right now, with a good bit of them having dependent coverage.
Okay, that would be the second group right there, is that the 100% group?
That is the first group retired before 2008. The 31 and 8 are current employees, that figure that I gave you. There's 31 that fall into the category prior to 2008, 31.
That's the top. The middle one there, retired before May 2nd. So we have 25, right?
We have
Plus
current 25 retirees.
Plus 8 people that are eligible currently, correct?
No, there's 8 people that were hired on or before 2008 that have 10 or more years of service.
As of July first, we had a total of 42 retiree spouses and beneficiaries on the rolls.
Majority of them have dependents.
I think this dependent and spouse thing, they didn't work for the district, why are we paying for theirs?
It's the way the policy was written, and this is something that hasn't been reviewed. And I don't know how long. Prior to me being here, prior to James being here, and probably prior to Chief being here,
And you
since
have
it's
a
been
copy of
discussed.
how this was written? I've never seen
I
it.
don't.
That's just.
I couldn't find that. It's not anywhere to be found.
We've been doing this and there's no record of commissioners voting for.
There is, it's just, I would have to go through each of those, a lot of the, commission minutes that are scanned are not searchable PDFs, so you can't see whether or not, you can't find it with a search on the network. You'd have to go through and read each one and find it.
Well, do we have a document sent to them saying this is what we provide you? Or, I don't know, I just think we ought to write a letter and say, sorry, we're no longer proud in your children or your spouse.
But that's something that we're here to discuss now,
Yeah.
as what, I just wanted to make sure that you all knew exactly what the policy is now. This has been
But the
vetted through
policy
an
is not
attorney.
written down and nobody approving of it, that you can find. That's what I'm hearing from you.
No, I don't have a copy of it, and I wasn't able to put my hands on the original of when it was passed. I got my information from the, actuary, and the actuary's been doing it for how many years?
Only 3 with this one, but the prior one had the same plan information from way back before our time, right?
Commissioner Laughlin?
Now, I'm not on this committee, but last week when Mr. Hancock was talking to us, he said that, if I remember correctly, that, this went into somewhere between 2005 and 2008, it was put on the books. That's what he said.
I think he was
I think
talking
it was,
about the OPEB liability going on the books.
Okay, and he
The
also.
liability, what he was talking about, I think he was incorrect in that statement, I agree with Lisa, he was incorrect in that time frame. I think it was prior to that, I think it was early 90s, I would guess.
Yeah. We went on the state plan in 1993,
And
So
the other
sometime
comment
right
that,
the health insurance.
the other comment that I remember, of course it can be out of left field again, was, somebody saying that if we do this without the employee approval and without going through it, we could very easily be looking at a lawsuit.
Well, the trouble with that is you can be looking at a lawsuit as soon as you walk out that door, drive down the street. So if your absolute protection is to avoid ever being sued at all costs, that's just,
Yeah, I know, quit
that's
breathing.
unreasonable. I
Well,
mean,
the whole-
For anything, but like I said, this is a discovery period where we're talking about these things. We're all learning about things that were institutionalized before my commission, before yours, but now it's in our hands to do the proper research and to do the right thing by everybody and hopefully come to some amicable, decision.
So is there no chance of looking back through the minutes of whatever meeting
just have to
back
read
in
'em all.
1961 if necessary?
And that's according to how complete they are. I might not have put it in there.
Surely we would have passed an ordinance that says we're gonna be doing this. That's the way I feel like. We would have just said, okay, let's do it. We would have passed an ordinance or something that said we did this. And we should have a list of all the ordinances we passed. How do we know the staff just didn't just slide this on and started us paying for this and didn't even inform the commissioners? We've got 2 senior commissioners I've asked and they don't remember anything about it.
Well, they can go back and do
I
the
can't
research.
imagine anyone would do that.
But our handbook, the only document that I have seen, says on the last page, on the last paragraph, says the commission will vote each year whether to fund
It
it.
says the commission has the authority or the ability to make changes on an annual basis.
Yeah, so let's use that authority. We cannot afford to do this. It's unfair to our taxpayers and our ratepayers to pay for insurance to people who never work for the district and their children who never work for the district. That is not fair to the taxpayers, and I was elected by the taxpayers. And
Well,
our
like I
ratepayers.
said, this is not the time to make decisions. I'm glad that you're letting your concerns be known. However, this is still the discovery process, and as aligned out by Mr. Hancock, there are, sounds very cut and dry, that there's 3 things, but there's so much room in here where it can be a staggeration of time with a reduction, with a match pay from the employee. There are other options. It's definitely not an all or none issue, okay? So I don't want anybody walking out of here thinking, oh, it's gonna be all or none, because it's not. Not as long as I'm here.
So I have,
Okay, let me,
no, go ahead.
and I know that you're not on the committee, and in future meetings, what I'm gonna do is I'm gonna try to keep the comments among the committee members, just to cut down, because the discussions and the comments that we're gonna have are gonna be hashed out in the full commission. But if it's something that you feel is absolutely detrimental,
Well, I was just gonna volunteer to work with whoever of the staff has all of these minutes, to sit down and read through, manually read
Thank
through them until we find something,
that would be
or
wonderful.
don't find something.
Yep, manpower would be a good thing, but like I said, this was, I'm bringing it out, I want y'all to see it's a serious issue, because there is no district without the employees and without the people that do the jobs. The job just can't do itself, and absolutely wanna keep our people happy. Yes, Commissioner Platt?
Thank you, Madam Chair. Just a thought, I don't have any position on it, but Mr. Wilson raised an interesting possibility here. What if they would have an ordinance passed and the funding was improper? A question, again, I don't have a position on it, but you thought about it. What about the benefits that have already been paid, perhaps improperly?
Well, I think it'd be very hard to get them back. Like my father used to say, water over the dam. But it's the future of this organization and these future costs that we're really worried about. And Mr. Hancock explained what happened in his district. Basically, when he got into office at the, is it the Lexington Sewer District? It was just wastewater they did. It was 5 years, and people would work their 5 years, go somewhere else, and then when they're ready to retire, the district would pay their health insurance after 5 years. He said they agonized over it, they went over it, and they changed it, and he said people were mad, but they changed it to 19 years. You had to be 19 years, and your last 19 years had to be at the district. And they cut out the spouses and the children and all that too, right off the bat, and just paid for the employees thing. But, and it made it more solvent, and it's something they could handle then. But, I think 5 years is too low of a bar. I mean,
It's 10.
oh, it's 10 here, but, yeah, 5 definitely, I think 10 is too. I can tell you the town of James Island does not pay for their retirees' health care. I can tell you Berkeley County, because I was employed, they're not gonna pay for my health care when I retire. There's people in this room, commissioners here, nobody's paying for their health care, nobody's paying for your health care when you retire. And to ask our taxpayers and our ratepayers to pay for, especially for the spouses and the children, I just can't see that happen.
Well,
And
like I
think
said, this is the
10 years
time,
is too low. I think it ought to be about 20 years.
this is the time period where the concerns are being raised. Excuse me.
You need everyone to
Order.
remember not to speak while we are speaking.
This is the time where we are getting the matter out. We're in a public forum, and we're not making decisions without the consult. And thank goodness we did have the good mind to review our rules of procedure, where now we can talk to employees. We don't have to go through one person at the top. And like I said, we're getting little bits of tidbits of information. Like I said, please don't walk out of here going it's gonna be all or none, because it's not. There are ways to work with with the situations that we have, to take care of the people that had promises made to them, and to look out for the future and the financial stability of, I mean, if this is just one piece of the pie, folks, and we've got a big operation going on here, but we wouldn't be anywhere if it weren't for our people. So that's what I wanna call your attention. I do believe there are some alternative plans that we're working on, and with the help of legal counsel, which, this is Chip, one of our attorneys, this is Attorney Miller, he's another attorney that works with us, and we have to proceed legally and morally sound forward, and to take care of our people that we have before. So that's, I just wanted to call it to your attention, this is something we are gonna be working on.
One second. You know, I swear, I think you went long enough to just left me. You know, my concern, and we don't do this in our budget, we pay more for consultants, not y'all, but add-on attorneys every year than we pay into this. You go through our consultant fees, because you wanna say, where's the plus? There's the plus. We pay more every year for consultants and this add-on attorney and that
Well,
add-on.
then maybe by talking to the employees and the department heads too, but the employees, the ground level people that are doing this, that's gonna take away, we won't have to consult with them, we can consult with the people that do it.
I would like, since our attorney's here, I would propose this question. It seems like to me that if we spend money and provide health insurance for retirees, their spouses and their children, there should have been an ordinance or something like that passed for us to spend that money. If we did this today, would we have to do this?
I think for me to give you all legal advice, I would need to look back at the ordinances and see what was passed. And as far as what we would pass to change something, or if we were to implement a policy today, I think that's a discussion that we would have, you know, in executive session, and then
Yeah,
let everybody know.
I understand that, but shouldn't there have been an ordinance passed for this? If we're spending money and giving a benefit to retirees, shouldn't we have passed an ordinance? I just feel like we should,
There would be a vote.
a vote of some type.
So you're, for the foundation of it. So, Commissioner Lockwood has volunteered to help staff go back through the records and to find the stuff. Like I said, this is where it happens, folks, so we've gotta get all the information first before any decisions are made. And I just wanna thank y'all for giving me this opportunity to bring this to light. Y'all talk to your people, if you have anything to say, please contact us. You've got my phone number, you got
One
my
thing,
email.
Ms. Clifford, is I understand that Commissioner Lockwood volunteered for that, but he's not on the administrative committee, so to me, if somebody should be looking at it, should be Kathy.
If he wants to do it, let him do it.
Amen.
Yeah.
Well, if we delegate it to you, then you delegate it to
Yeah,
him, how's that
okay,
sound?
all right.
Alright, we're approaching 6:43, we have a public meeting, do I hear a motion to adjourn?
I'll make a motion.
Ms. Poston seconded it. I'm sorry, I made the motion, I don't know.
Yes, that's what I was.
Any objections? The meeting of the administrative committee is now ended, thank you.